Thank you. Ladies and gentlemen, the always informative and very entertaining Dr. Allen.
Thank you. Thank you. Thank you. So a strange phenomenon happened the other day. I was in the market for a car. My car is sort of on the fritz. So I went to a local Ford dealership. And I was looking at this very big car, the Crown Victoria. I don't know if you know the Crown Victoria, you know, often used by police cars and stuff. But I inquired into the purchase of a Crown Victoria, and they told me that unless I was a police officer or over the age of 90, I wasn't allowed to purchase a Crown Victoria. Something seems to happen as we age. If you're a woman, as you get older, your car gets smaller and smaller and smaller. But if you're a man, as you get older, your car gets bigger and bigger and bigger. And I think if you actually made it to the age of 150, you'd be buying a Sherman tank as your next vehicle. Now, when you're getting a little bit older, if you want to go to your local bank or your local 7-Eleven, the way to do it is through the front door, not through the front window when you've confused your brake and your gas pedal and smashed through the window. I mean, something happens as you get older. I mean, this gas pedal and brake pedal, instead of being two separate entities, seems to morph into one big pedal, and you sort of just step on it and hope for the best, and things will work out for it. Sort of gives new meaning to the word door crasher event.
Or drive-through.
Or drive-through, right, that's right. Or drive-through. Maybe it's got something to do with those Terminator sunglasses. Have you seen the old people wearing these sunglasses that sort of wrap around that block sunlight from everywhere? And every time they put those on, it seems like they've just been auditioning for your latest Terminator movie. But really, continuing on the theme of driving here, apparently in the province of Ontario, once you reach the age of 80, you have to go in every 2 years for a driver's test. And I think this is a wonderful phenomenon, because not only have they got you captive for your driver test, but they can use it as sort of a general intervention of the sorts. Suppose we have a fashion consultant there. So when you come in with your black socks and sandals, which is a fashion faux pas, you automatically get your license suspended.
Or those white mesh sneakers.
Or those white mesh moccasins.
Yeah.
If you come in with those white mesh moccasins, your license gets revoked. And if every item in your clothing closet is either gold or cream colored, that's it. You never get to deliver your license.
That's it.
Ladies, we have a great show for you today, ladies and gentlemen. We have our healthcare expert. We have a segment we call Second Opinion, and we have our medical expert panel. Please put your hands together for my good friend, Mr. Ari Kazel. Don't go away. We'll be right back. Welcome back. Welcome back.
Dr. Allen, you're an investigative coroner.
Correct.
Are you seeing anything out in the field that is particularly concerning to you?
Actually, there are some particularly concerning things I've been seeing as a coroner lately, Ari. And one of them is people ignoring their symptoms of heart disease. So I'm often attending these home deaths on people, and when you go through the history of them, you find out that the day before or during that day they had complained of chest pains or chest tightness, and they've ignored their symptoms, hoping that they would go away. And this applies not only to young people, it applies to elderly people as well. And I think it is a wrong thing to do. I think that maybe some people think that they're burdening the healthcare system or unnecessarily visiting their doctor when they get some chest pains. But if you're over the age of 55 and you're developing chest pains or chest tightness, you can't be ignoring your symptoms. You need to go seek medical help. And I'll tell you right now that the wrong person to see is your family doctor if you're elderly and you've got chest pain. You need to go to the emergency department. There's very little a family doctor can do in his office in terms of often no ECG. Sometimes they do. But in terms of immediate blood work and other investigative procedures, you need to be seen in the emergency department. So if there's one message I can give out to the older people or seniors out there is if you're developing chest pains at home, don't ignore your symptoms. Go to your local emergency department hospital and be looked at, because you don't want to see me the next day as a coroner.
The message is simple and straightforward.
Straight message.
Yes.
Okay, I'd like to welcome our first guest. He's the president and founder of Foremost Fitness Corporation. He's located at Eglinton and Avenue Road. He's going to talk to us about fitness and exercise as we age. Please put your hands together for Mr. Michael Wiseman. Thank you so much for being on the show, Michael.
Thank you, Dr. Al.
So you're a fitness expert. You sell fitness products, and you personally advise people and train them on fitness.
Yes.
So what are some of the changes that happen to people as they age that you've been noticing that sort of provide a barrier to maintaining your fitness?
Well, there's quite a few things as people age. One of the most noticeable that I see is people tend to stiffen up. Their muscles and their joints are not as flexible as they used to be, and it can inhibit people from exercising properly. It can inhibit people from living daily life properly, playing with their grandchildren and so on. There's a variety of other things, posture issues. When you've been sitting at a desk all your life and driving a car, you tend to put your head forward and roll your shoulders forward, and this can create a lot of problems in the neck and in the shoulders in particular. Lots of pain. Oftentimes it goes into the back.
So does this produce like a muscle imbalance that affects people's gait and their posture?
Yes, you could say that.
I just did, Michael.
Good.
So what are some of the things that someone can do to sort of combat these changes, and what do you recommend?
Well, the first thing I would recommend is to remain active. The most important thing is to keep moving, because that keeps the lymph fluid flowing, the circulation, that keeps all the muscles limber, it allows you to stretch.
But what if I'm an older person?
Mm-hmm.
I've got arthritis, I'm achy all the time, I may be in chronic pain, I'm stiff. Isn't it sort of easy to say keep moving, or is there some way for some person in that situation to actually keep moving?
There's always it's never too late, first of all, and there's always something that everybody can do, even if they're confined to a chair. There is all kinds of exercises, and oftentimes the misconception is that if you have not been active, you haven't been working out, you are not accustomed to exercise, that you can't just start exercising. It's actually the opposite. If you've been sedentary all of your life and you've been at a desk all your life, you haven't ever exercised, that's probably a good reason why you're having some of these symptoms.
So what you're saying then, it's never too late to start?
Of course, yeah.
But I presume, though, if you haven't been active and you want to start, there's a risk of causing some harm or hurting yourself if you go at it too hard from the beginning.
Yeah, we often advise people to start off very slow. You know, your exercise segment shouldn't be too intense, and they shouldn't be for too long. We don't want to discourage people from exercising to the point where they're sore the next day. You always start off slow.
Well, what are some of the things that someone who struggles with mobility issues can do, simple things that they can do at home to maintain their flexibility and their strengthening and conditioning?
Well, pretty much any kind of movement. If you don't have a piece of equipment, you could go up and down the stairs, do step-ups. You could do a variety of different stretches for your upper and your lower body. There's all kinds of different exercises that you can do at home.
What are the benefits? I know you mentioned something about lymph flow and muscle tone and things like that. Are there any other benefits to sort of a very measured exercise program as you get older?
Well, a lot of times people are looking at the physical, but a lot of it can be mental. It improves confidence. It makes people feel better about themselves. It allows people to feel more independent as they age if they're more fit. There's all kinds of benefits.
What are some of the products that you sell in your fitness store that someone who's a little bit less mobile might benefit from? Now, I know there's sort of the stretchy things, there's balls, other things. What are some of the products that you notice that people are buying these days?
Well, there's quite a few different things available in the market for elderly people. One of the things we're noticing that's one of our most popular items are the foam rollers. People get down on them and they roll their different muscles. They release the trigger points, they release the muscle adhesions. They're really good for flexibility.
Now there's a foam roller as opposed to a steam roller.
Yes, yes.
Because that would just flatten you out.
That would just flatten you out. It probably wouldn't be very good.
Are there any no-nos for seniors that you can think of? things they should avoid, especially if they're starting out?
We never encourage people to lift really heavy weights. Really heavy weights.
That's what you think about when you think about working out. You have these images of being in the gym and barbells and heavy weights and stuff like that. But you're saying no, if you're elderly, that's not the way to go.
Well, we want to increase some muscle tone for strength, and when you have more muscle, you burn more calories at rest, and there's a lot of benefits to having more muscle. So light weights are okay. You start using a lot of heavy weights, you get joint issues, and a lot of heavy weights can tend to keep the muscle in a contracted state rather than an elongated state, so then there's going to be more pain associated with tightening of the muscles, tendons, ligaments, and so on.
Mr. Wiseman, I thank you for being a guest on the show. Very useful information. Don't go away. We'll be right back. Thank you. Welcome back to the show. It's time for our medical expert panel discussion. To the right of me, Dr. Paul Drusen, who's a family physician who's practiced emergency medicine, hospital-based medicine, rural and urban family medicine. To the left of me, Dr. Roman Ellison, who's a family physician in Toronto who's practiced emergency medicine, hospitalist medicine, rural family medicine, and also has a house call service in Toronto. Gentlemen, thank you for being on the show. Let's delve right into it. The internet. Has it become the friend or the foe of the current physician? Paul?
Well, I think access to information is a good thing for everybody. So in the past, if we wanted to look something up, we probably have to go to our library that we'd have, but now we have internet access to information, which is a useful thing.
Okay, so you're saying as a physician, the internet has improved your access to information in a more timely fashion?
As it has for everybody in society.
Okay, that's a fair comment. But what about from the aspect of patients coming in now, having often self-diagnosed themselves before they've even visited the physician, with now a wealth of information to lay at your doorstep when they see you?
Well, having more educated patients is usually a good thing. Of course, if the patients, you have to be careful on the internet what information you get, and it takes experience, it takes years of being a physician and seeing multiple patients before you kind of get a feel for it. So it's hard for a patient who's not a physician just to read something short and then come up with a diagnosis that you know is not true. And yes, probably internet has probably increased that. It probably has increased the frequency of that. But I think that problem is outweighed by the benefit of easy information for everybody.
Yeah, I mean, I would probably side with Paul. I mean, first of all, access to information is absolutely key. I mean, as a general practitioner, right, you're sort of expected to have a proficiency in in a wide variety of subjects. And
right, but I want to sort of focus a little bit more on the patient's access to information.
In my experience,
and your visit with them.
In my experience, it's been a double-edged sword. It really depends on the patient. I mean, some patients sort of know how to use the internet. They use it wisely, and as Paul said, they present as an educated patient, and they're actually very helpful. And quite often they can understand that there might not be a definitive treatment or definitive management for something.
But do you find patients coming in when they need not present because they've read about something on the internet?
Because they've become hysterical because they've read something? Yeah, it happens, absolutely. And obviously, it's probably it's become a phenomenon now that the general public has access to basically unlimited resources when it comes to information.
But has it changed the interaction with your patient?
Well, it certainly made the interaction longer.
Okay.
That's for sure, because there's a lot more to talk about. There's a lot more myths to dispel. I mean, but then you also have the phenomenon of Dr. Oz, who will put forth all sorts of information out there. Some of it is valid, some of it is probably not so valid. And then patients come in. Oh, I heard this on Dr. Oz. Can we talk about that? That's been my experience, and so it takes a lot longer. So that's a bit frustrating.
Paul?
Well, before internet, people had other sources of information. They could have gotten, crazy ideas from their grandmother and came in with the doctor with some crazy beliefs. Perhaps the fact that they read it on the internet, they're more likely to believe it, and it'd be harder to dispel the myths. Maybe. I think it really works both ways, but I think overall it's probably a good thing. More information is usually a better thing.
Do you find that it has challenged the paternalistic model of medical healthcare into more of a shared decision-making process, which, in fact, some people would argue is a more beneficial way of dealing with patients in medical care?
I think as long as there is a respect between the physician and the patient, and both know that one is the physician and one is the patient, then I think that is good when the patient has more information. I think it's a different issue and not an internet issue when there is a lack of power or a lack of decision-making power within the doctor's hands. And then the internet, like many other facets, will actually be a damaging thing. So the only problem from the internet would be when there's kind of a disempowerment of the physician. And I don't think internet in and of itself is responsible for that. But certainly other things in society are.
I mean, it might facilitate that to some degree. But I mean, I think the internet has definitely democratized, medicine.
You alluded to longer visits. Do you find patients coming in with terms and sort of phenomenon that they've looked up on the internet and come to you for explanations of which have absolutely nothing to do with their actual problem or visit?
Well, sometimes they're not necessarily relevant to the visit, but sometimes they are. But what the patient might not realize is that it's actually a very complex issue, and to explain it in a comprehensive way takes a really long time, and also presupposes a level of conceptual knowledge,
medical base,
exactly,
and knowledge which they may lack.
Well, then you find yourself explaining, some of the assumed presuppositions. Why can't I get a test for this? Well, you have to then explain the concept of sensitivity and specificity and false positives. You have to get into a whole statistical conversation in order to even approach the original question. So it ends up being a long, and then you have to sort of negotiate, that and keep an eye on the time,
Okay, so then could we conclude then, in closing for this segment, that a little bit of knowledge can be a dangerous thing?
Agreed.
Yes, agreed.
Gentlemen, I thank you for your time. Don't go away. We'll be right back. Thank you. Welcome back to the show. This is a segment we like to call Second Opinion, where questions are relayed to us through SenioLand.com from actual viewers. So Kevin, you have some of the questions that people have been dying to answer. Let's see if we can answer them for them.
Yes, Alan, some more interesting questions. One of them that have been coming up a lot is the patient said that I've heard so much about drug-drug interaction and the risk of overdose. I've heard so much that I'm even scared to take my own medication that my doctor gave me. What makes all of these medications so dangerous?
Okay, so what I'm hearing is that some people are concerned about taking some of their medications and the risk of overdose. I presume they might be talking about pain-related medications such as narcotics or opioids, although I don't think they specifically indicated which medication.
No, it wasn't indicated.
But I'll talk about those medications in particular. As a coroner as well, as an emergency physician, I see a lot of opioid-related deaths, either accidental or intentional overdoses of opioid medications.
It's very unfortunate.
Yeah. What makes these medications so dangerous is that if you take them in large doses, which your body is not accustomed to, they actually suppress your respiratory system. So they suppress your ability to breathe to the point where if you take enough of it, you'll stop breathing. And that's how they exert their effect. Now, you may not be taking too much of a particular opioid medications, but there's co-ingestants, such as other medications you might be taking too, which produce an additive sedative effect, such as benzodiazepines or some SSRIs can, in addition to that, combined, the overall sedative effect can be quite dangerous. If you add alcohol into the situation as well, which we often see at coroner cases, drinking with these medications in particular can be particularly dangerous. So those are some of the things you want to be careful for. Basically, you want to go low and go slow. Your body has to become accustomed to them. And sometimes people get tempted to take too much because their pain may not be under control, but it can have dire consequences if you do it in an irresponsible fashion.
All right. The other question is about the ER waits. People are worried that is the ER really safe today? It used to be much more easier before. You could easily see a doctor when you go there. Now you have to wait so long. What are the dangers of waiting so long, and is the ER in general in Canada safe?
ERs in general are safe. What you hear in the newspapers are isolated incidences of people dying in the waiting room. These are far, far remote circumstances, and it's not a trend. In fact, ER wait times are actually going down. Look, disaster is going to happen on occasion that no one can predict and no one can plan for. It's an unfortunate part, but I can tell you that the emergency departments are very safe, and no one wants to see accidents or incidences that happen. Fortunately, they're quite rare, but when they happen to you, it's not very pleasant.
That's reassuring.
Thank you very much, Kevin. I appreciate you assisting me on a second opinion, and don't go away. We'll be right back. Ladies and gentlemen, I want to thank all my guests for taking the time out of their busy schedules to join us today on the show. I want to thank my better half, Mr. Ari Kazel. We hope you found the show to be both entertaining and informative. Until next time, I'm Dr. Allen, yours in good health.